We have the 24/7 people who are called NCAs, or Neonatal Critical Associates, and that's where I fit in. So my group is 5 physicians and me currently. So on a day-to-day basis, when I come in the morning, whether I'm on what we call the intensive side or the intermediate side, there's lots of help during the daytime. We round on all the babies with the neonatologist. We examine all the babies in the morning. We decide the plan of care for the day before rounds. We present on rounds, just as residents and other physicians do. We have a team discussion about the baby. Then in my job, I'm writing the orders, writing all the daily notes, and then attending deliveries, doing procedures, doing antenatal consults. From 5 o'clock till 8 the next morning, if you're on night call, you're the only person in-house to manage a 27-bed unit. So anything that happens at night, we are trained to do to manage the baby from the time of delivery or even before delivery. And if you need help, you would call the neonatologist in, or you can consult with them by phone. We are trained for all the competencies from intubation, chest tubes, lumbar punctures, any medical procedure that happens in the NICU is the job of the NCA. The neonatologists typically don't do procedures anymore. They act as consultants. Because up till about 15 years ago, we had no in-house help at night. It was the nurses and the respiratory therapists. So now the babies are getting the care they deserve because we have expert caregivers in-house around the clock. The decision-making, the managing the complications, those are the kind of things that not anyone can learn. That comes with experience. And so for me, the procedures were not the scariest part of doing it all. It was all the additional knowledge you need to move into that more medical role. Because as nurses, we are scared to diagnose. We do it all the time, but we're scared to say what our diagnosis is. I think it's that idea that you are sending home to the family a baby that's going to be a valued member of that family for the next 70, 80 years. You know, in what other specialty do you get to give a 70-year cure? It's sacred being there at the time of delivery, helping these babies, watching this family evolve, watching them bond with their child, watching them bond with us staff. And it's a relationship that continues for many, many years. I would say the most challenging aspect is explaining to families what my role is. Because I make a point of always saying I'm a neonatal nurse practitioner. But I think a lot of the families still think I'm one of the staff nurses. When the doctors and I are rounding and they introduce me, they don't make a point of saying I'm the nurse practitioner. They say, well, this is Moni, she's part of our team. And so I think as NPs, we really have to continue to highlight what it is we do, what it is we bring to the team. And the public still needs a lot of education about what nurse practitioner means, because often the practitioner word gets dropped. We still need to educate people about what it is that we do and what we bring to the role, or what we bring to the care. Within acute care, there is such a need for specialty roles. And at some point, to improve the care, we're going to have to figure out how to make that happen. Because there should be a way for nurses who are very experienced in cardio sciences and emergency medicine and pediatric medicine to become specialty care NPs so that they can just continue to provide better and better care without leaving the area that they love.